An enlarged prostate means the gland has grown bigger. Prostate enlargement happens to almost all men as they get older. Have you ever thought about why older people need to go to the bathroom more often? Your prostate might be trying to tell you something. An enlarged prostate is often called benign prostatic hyperplasia, BPH. It is not cancer, and it does not raise your risk for prostate cancer. The prostate is a gland that produces some of the fluid that carries sperm during ejaculation. The prostate gland surrounds the urethra, the tube through which urine passes out of the body. A small amount of prostate enlargement is present in many men over age 40. More than 90% of men over age 80 have the condition. Self-care steps are often enough to make you feel better. So if the testicles are removed after a man develops BPH, the prostate begins to shrink in size. However, this is not a standard treatment for an enlarged prostate. If you have BPH, you should have a yearly assessment to monitor your symptoms and see if you need changes in treatment. Let's talk about the symptoms and signs of a swollen prostate. One of the most common signs is having trouble starting and keeping up urine. When the prostate, which surrounds the urethra, gets bigger, it squeezes the urethra and puts pressure on the bladder. This causes bladder delay, which means it's hard to start and keep a urine stream going. Some patients may have to strain a lot to start or keep urinating. Sometimes there is a weak pee stream that comes and goes. This is another sign. This is because pee is moving through a urethra that is partly blocked. Long urination is another sign. It takes longer to urinate because the weak and irregular stream from the partial block makes it take longer to do so. Nocturia, or going to the bathroom at night, is common in people whose prostates are enlargement. Patients often wake up in the middle of the night with the need to go to the bathroom, but they may only be able to pee a little. This can make it very hard to sleep. Encore voiding is another sign in which a person feels like they need to go to the bathroom again right after they're done. This could be because of extra pee in the bladder. I can imagine how hard it would be to push pee out of the bladder through a blocked urethra, leaving behind urine in the bladder. So, you may feel like you need to go to the bathroom even after you're done or think you're done. If the prostate gets too big, it can press against the bladder, especially in the trigon area, which is a very sensitive part of the bladder. This sensitivity makes you feel like you need to go to the bathroom again, which can lead to symptoms like nocturia and repeat voiding. One of the other signs of a swollen prostate is increased urine frequency, which means going to the bathroom more often. We've already talked about nighttime urination, but daytime urination can also happen. Even though you may be peeing more, the amount of your urine may not be very high. This isn't because the person has a full bladder and needs to go to the bathroom a lot, like in some other situations. It's because the prostate is irritating the bladder, or the person didn't completely empty it, leaving pee in the bladder. Urinary discomfort is another sign that your prostate is getting bigger. If you feel like going to the bathroom quickly, it's probably because you moved around, like when you rolled over in bed. This movement can change how the prostate presses on the bladder, making you need to go to the bathroom right away. Another sign is dysuria. Along with needing to go to the bathroom often and urgently, dysuria may look like a urinary tract infection. However, because of other signs, it is more likely to be caused by a swollen prostate. Compared to haste and regularity of urination, dysuria is a less common sign. Post-void dribbling is when dribbling happens after you've gone to the bathroom. Some dribbling may always happen, but if your prostate is swollen, it can be bad and last a long time. This happens because of pee that stays in the bladder after urinating, because it's hard to pass through the narrow urethra. When the prostate gets very big because of benign prostatic hyperplasia, it can cause people to hold their urine. This happens when the prostate gets too big and squeezes the urethra too tightly, stopping pee from moving. When you have urinary retention, you either can't pee at all or can only urinate very little, even when your bladder is full and hurting. This is basically a blockage of the bladder opening and is a very bad side effect of BPH. Urinary buildup can cause acute kidney damage. Even when the bladder is full, the kidneys keep making urine. This makes the urine back up in the bladder and into the ureters and then into the kidneys. This can cause hydronephrosis, which is when fluid builds up in the kidneys, and chronic kidney disease, which could require dialysis if it is not treated in time. Having blood in your pee is another sign that your prostate is getting bigger. It's generally microscopic hematuria, which means that you can't see the blood in the pee, but it might be there. A big prostate makes the urethra swell and irritate it, which leads to this. Now let's talk about some symptoms and danger signs that could mean you have prostate cancer. All of the above signs can happen if you have prostate cancer, but the ones below are more likely to happen. If you have back pain, fevers and chills, hot flashes and night sweats because of changes in your hormones, signs of spinal cord compression that can lead to cauda equina syndrome, or hidden kidney failure, you should see a doctor. Benign prostatic hyperplasia, BPH, is a frequent disorder in elderly men. Due to its proximity to the urethra, which conducts urine from the bladder, prostate enlargement can cause urinary problems. Men's prostate glands gradually increase with age, which can constrict the urethra and compromise bladder function. BPH symptoms include difficulties commencing urination, a weak urine stream, frequent urinating, especially at night, nocturia, and a sense that the bladder is not emptied. The enlarged prostate blocks pee flow, producing discomfort and bladder control issues. Patients with severe BPH may experience urine retention, which can be a medical emergency. BPH is benign, although its symptoms might resemble prostate cancer. Changes or difficulty in urinating, especially in older men, should be reviewed with a doctor for diagnosis and treatment. Depending on symptoms and health, BPH treatment might include lifestyle modifications, drugs, and surgery. Monitoring the illness and controlling consequences requires regular medical checkups. BPH is a common aspect of aging for many men, but it can affect quality of life. Thus, medical care is always advised. Dear viewers, if you found this information helpful, please consider subscribing to stay updated with more useful content like this. Your support means a lot. Thank you.